John Podolsky. I am Senior Vice President of Experience Strategy and Service Design here at Mad Pow. And what I do is really connect brands and services and products with customers and really evaluate, do they work? Are they working to the expectations of the market, of competitor pressure, and really of just what customers are looking for. We don't do anything unless it is from the mouth of a customer or a consumer or a passenger or a patient first. It's not our opinions, it's not what we do as individuals, as a consultancy, or even my personal experiences. It's those that we observe, it's those that we explore from a research perspective. So looking at their needs, their idealisms, what their objectives are, and then translating that and really advocating that to those who are making decisions within brands or within the executive suites. That's what I do. That's that connection that I bring to that. So it's all human-centered by nature. Without a human-centered perspective, it's just my opinion, and I tell people don't listen to me. It's not my opinion you should be listening to. I'm here to invoke and to translate that of your actual customer base. So the intersection for me is, well, there's a few different spots, right? One is even the methods that we use to collect and engage with customers. I mean, years ago, it was simply just walking up to an individual and asking what their opinion was. But in doing so, it's only a moment in time, and that's a limited perspective in terms of their purview of whatever it is that we're looking at and researching. So integrating technology now there is figuring out ways and methodologies to expand our observation methods and our observation techniques of what a day in the life could potentially be when it comes to interacting with a brand or a service. So looking at things like online journal studies and other digital methods, different devices that can track or in a very passive way start to collect what it's like to actually be a patient, or what it's like to actually go through a procedure or a surgery or get a medical diagnosis, but doing so as a fly on the wall that's not intrusive or interruptive. So that's one way that we're leveraging technology. But then certainly the other is around really figuring out new engagement models. How are we going to communicate with patients or facilitate interactions with the actual healthcare services beyond just a written letter or form or walking into a waiting room? Are there other parts of the experience that we can expand and own in leveraging technology to do so? So my personal mission is my son and myself actually were recently diagnosed with a relatively rare genetic disorder. For me, I've had it my whole life and didn't even know I had it for in this 30+ years. But for my son, it manifested in a more impactful way. So I have now, not only as a consultant, observed and been a researcher when it comes to patient experiences, but in my own experiences now, seeing my son at 5 years old be at the doctors and go through so many procedures, over 150 visits to hospitals at this point in 5 years. So I'm very keenly aware that every single day that I have to bring him into an institution or a clinic or a hospital is a fun day I'm taking out of his life potentially, and I don't want that. I don't want those days to be a negative day to him. I want those to just be another day, a small blip on the radar of his life, and to actually remove what is now perceived as a negative. And so that's my real motivation at this point, is to turn these patient experiences, especially for pediatric patient populations, into a positive as much as possible, or really just reflect the fact that children have different needs, and that the fact that they want to still learn and explore in a health environment. That doesn't mean that has to stop. You can still even introduce what health is like, or the exploration around that, or even some of the wonders that they have of the crazy machine, or this procedure, or this medicine, or this technology. All of these things are things that we could actually turn into a learning experience or an explorative experience for children. So that's been like my personal mission. A lot of the work that I've been doing now is actually in pediatrics when it comes to experience design. Really motivated just by seeing what it's like with my son in the amazing hospitals in Boston, still kind of have the same struggles that are everywhere in this country. Don't give up. I know sometimes these conferences or what we talk about is more disparaging than inspirational, in the sense that there's so much strife or so much struggle to make change. It's only going to work if we keep at it and we keep trying. So I know I have my motivation, my personal stories, my son. He keeps me going every single day, whether things work out or not in terms of individual initiatives or success or failures. But I know others have their own motivations, and I just ask that they find that motivation to keep going.